Dear friend, welcome to YouTube channel. And name of our channel is Dr. Vet or Dear Vet. DRVET. Today we'll talk about diseases due to deficiency of zinc. I'm Dr. PR Patel, and in this lecture we will see etiology, pathogenesis, clinical manifestations, diagnosis, differential diagnosis, treatment, and prevention of zinc deficiency. The etiology of zinc is divided into two parts: primary etiology and secondary etiology. Primary etiology, there is zinc deficient ration. If the animal consumes zinc deficient ration, animal suffers from zinc deficiency. Another important etiology is when soil is deficient in zinc, the plants, fodder, or grass grown on such deficient soil also remain deficient. When animal consume such grass or pasture, animals suffer from zinc deficiency. The legume plants contain less amount of zinc. So when you feed the legume plants, give also other cereal grass also. Zinc concentration decreased with aging of the plant. The young plant contain more zinc in comparison to older plant, old aged plant. So while feeding also take this into account. Increase in nitrogen and phosphorus content of soil also compete with zinc absorption, and animal suffers from zinc deficiency. Let us see secondary etiology. Among the farmers, now there is custom to get more and more growth in young animals. They feed more calcium. But remember here, excess calcium causes zinc deficiency. Similarly, excess dietary sulfur also causes zinc deficiency. High level of copper will decrease the zinc requirement of the body. And when there is diarrhea in the animal due to any reason or due to enteric infection, the feces passes very fast. There is pathology in intestine. So zinc absorption is comparatively less. So in diarrhea cases also there is zinc deficiency if it is long time. During pregnancy, especially at the latest stage of pregnancy, the growth of the fetus in uterus of the mother is very fast. So during this period, there is more zinc requirement. And if it is not supplied orally or in the diet, such pregnant animals suffer from zinc deficiency. Similar is the case with lactation. If lactation yield is very high, the zinc is excreted in the milk, and if sufficient amount was not given through diet, animal suffers from zinc deficiency. Also, during rapid growth period, there is fast growth of the young one at the 7 to 10 weeks of age. Due to fast growth, there is high requirement of zinc also. If it is not supplied properly through oral or in the diet, such young one suffer from zinc deficiency. Now let us see pathogenicity, how the zinc is important for the body. So important thing is that zinc is a component of many enzymes, but three important enzymes we'll see later in this slide. The first enzyme is carbonic anhydrase. This enzyme is very important for maintaining acid base balance and helps in transport of carbon dioxide. Transport of carbon dioxide from cell to lung is a must. Second is zinc is a component of alkaline phosphatase. This enzyme plays an important role in the breakdown of organic substances, and it is predominantly present in liver and bones. It is called as ALP. The third important enzyme, lactic dehydrogenase, LDH, it is very much useful for the interconversion of pyruvic acid and lactic acid and back. So zinc is a important component of these three enzymes. Zinc is also associated with RNA function, certain hormone, insulin, glucagon, and other hormones. In this slide, we will see which are the symptoms produced when there is zinc deficiency. One is the retarded growth. Second, skeletal disorder. There is poor growth of the bone. Bone become very fragile. Fracture is caused spontaneously, very easily. There is joint stiffness, lameness, lesions around hoof, pododermatitis, and abnormal hoof growth. These are the characteristics of the zinc deficiency. Another important characteristic is abnormal keratogenesis. On the skin, there is keratin layer. That keratin layer is affected, and due to this, the hair coat become rough, dry, scaly, and hair falls very easily. It is called alopecia. Two abnormal type of keratogenesis observed due to zinc deficiency. One is important. Zinc parakeratosis occur in pigs. Here there is imperfect keratinization of skin. Keratinization is not proper. The another is hyperkeratosis in cattle. Here there is excessive keratinization. In pigs there is imperfect keratinization. While in cattle it's different. In cattle there is excessive thickening, excessive keratinization manifest by dermatitis of skin of head and neck. Zinc deficiency also leads to infertility and delayed maturity. So it affects reproduction also. Diagnosis, certain history that certain geographical area the soil is deficient in zinc is also important for a clinician. The clinical findings we have already seen that it affects hairs and skin. There is parakeratosis in pig and hyperkeratosis in cattle. The disease is further confirmed by estimation of zinc level in blood. Differential diagnosis, such symptoms, alopecia, parakeratosis, dermatitis, thickening of skin, is also observed in few other common diseases. Mange also causes such skin disease, but it can be differentiated by examination of skin scraping under microscope. Clinician can find the mange, sarcoptes or soroptes. Ringworm also produce dermatitis. It is caused by dermatophytes that also can be diagnosed by characteristic clinical signs, a ring form of dermatitis. It can also be diagnosed by examination of skin scrapings. Vitamin A deficiency also produces such symptoms. Give vitamin A treatment to the animal. If there is cure, then we can say that it is a case of vitamin A deficiency. Other diseases also, but they are not very common. Treatment of zinc deficiency is very easy. Zinc sulfate or zinc carbonate given orally in feed. Injections of zinc oxide can also be given. For dose information, please refer standard book on veterinary medicine or pharmacology. It is easy to prevent also. Give short licks, especially to young calves, that contain zinc. If that soil is deficient in zinc, then give zinc containing fertilizers to the soil. So the pasture grown on such soil will be rich in zinc. That also help in prevention of disease. Intraruminal pellets are also available. They are heavy pellets. The pellets settle down in the rumen and slowly they release zinc over a long period. Dear friends, you have observed the video on Dr. Vet channel. Requested to subscribe such videos so that I can prepare more and more videos on veterinary medicine aspect. Share such videos to our veterinary friends, to the farmers also, to enrich their knowledge and to provide service to our animals. Thank you very much for observing this video.